you so much.
Well, thank you. And thanks also to Kathy making this connection so that we could discover and be here and part of this. So we had an opportunity to discuss, and we were trying to think of, there's such a variety of things that your group, diversity of needs, diversity of ages, and everything else. So what you might be searching and needing. So we ended up really looking at what can be the components that will help you find a therapeutic situation that you think is appropriate for your child. And I know that in some cases we are talking about adults, and those are very different in regards to trust funds, or how do you work with attorneys, or how do you work with housing and those kinds of things. And I will say that over the years that Maureen became very, very amazing. And we met her when John, and a lot to try to also help. And I see that quite a bit, much more here. I've also have a home in Traverse, and we're companies here in Traverse and Lansing and Grand Rapids. And I just, some of those components that I know it's still lacking. What we hope to do is just give you maybe an overview. We are children based. And I'm the founder, and now Matt is, as you were sharing, carrying the torch and keeping the company moving. We started in Midland and went to Traverse City. Matt came back from his master's degree in speech pathology and business and took over, and then got us moving into Lansing and into Grand Rapids. So it's been quite a journey, and this is going to be our 29th year. So we were here when nothing else was around, and it's been a journey, but it's been a good one. So what we thought that we would go through is maybe some things, and please stop us at any time, because some of you I've met, but now we're not dealing with a child. The reason that we did,
There'll always be a child to me, I'm sorry.
Actually, so my baby.
Perfect.
he,
We're on the same page.
he actually worked with your son.
With Nathan, yeah.
Yeah, Nathan and I hung out for a few years.
Yeah.
Well, Tom and I hung out, Nathan and I worked together.
Yeah, you tortured Nathan, no, no, that was a physical therapist, doing Nathan.
Yeah, it was. Sometimes we co-treated just so that I could distract from their meanness.
Yeah.
And movement. So the reason we started was because 29 years ago, nothing in this town, nothing, no insurance coverage. It was absolutely void of any type. And I'm not saying there weren't things in the schools, but the hospital was not, still is not pediatric based. There's now you got a proliferation of some of these facilities, but more of that is really based because the insurance laws have changed in 2012. And so autism is, because of legislation, now every child will get that service, but every other is not always a full component. So what we thought we would work through today would be, and please discussion, give us feedback at any point, that we'll kind of tag team, thinking of if there's some components to talk about with insurance. There's also a component to share about maybe, and again, I don't know the ages, so maybe that would be a good thing to go around and see what concerns and ages. But not only from an insurance perspective, and we talked a little bit about that, how it, I could talk to all of you about what the problem with that is. Just what to maybe look for if you know that you've got somebody who's specialized. And the reason that it is children's therapy corner, it's not everybody's therapy corner. We make very strong that children are not short adults. The differences are it's a developing brain, the body is developing, there's nothing that is synonymous. And so that's why our program, we are not working with adults, because it's two different things. And we want, and that will go into some of that, we want our therapists to be specialized in children. That's all we do, and we want to do it well. So that's kind of what we were planning. If you guys have anything else that just advocating and what you can do, are there any things that you guys, that was a very brief overview, anything you hope we can touch on? We just kind of talk. We just like to just talk. Can you tell we're also speech and language pathologists? So is there anything particular or anything that you hope from this dialogue?
I just want to mention, just seeing who showed up today, I was thinking that the audience that would come to the presentation would be mostly parents of younger children, but all of us have adult children, and I am wondering if we can maybe talk a little bit about working with private insurance, because I know you have
Yes, we can.
some experience in terms of the billing and in terms of the preferred plans, because this is an ongoing thing, as the need for therapy doesn't expire. And in a way, the maybe justification needs to be different. It's more maintenance of skills, or more about decreasing pain levels, etc., whatever the situation is. But it's always an uphill battle, right, for the families, justifying the continuation of services and achieving of goals, even in situation that basically the condition is non-progressive. So
And I appreciate you bringing that up, because even though we only work with children, having been with the company 29 years old, there are a lot of adults, young adults, that we know of in the community that we've had the opportunity to work with when they were younger. But you're right, we may not be the direct intervention, but we can sure talk about from an insurance component. There's because when we started the company, there was no insurance coverage. Nothing. So I could spend 2 days on that. In fact, I was meeting with our director of clinical services, with Matt, myself, and one of our people out of the billing, and we're working directly with the head medical director of Blue Care Network on some issues. And we've also worked directly with Blue Cross Blue Shield. So in all of these years, a lot, and it's been a lot of work, but there are a lot of things that have changed because we fight the insurance companies, and we have won more than we have lost, I think, at times, but it's still an uphill battle. So insurance, is that, yeah.
I just have I definitely second that. So I have a son that just turned 18. That has
Congratulations.
autism, yeah.
And also, I'm sorry.
Right, yeah, we're getting a little bit of the teenage attitude of, independence, which I like to see, but yeah. And then a 15-year-old that has an IEP also. Oh my gosh, he just turned 16 this week. Oh my gosh, he's 16. Anyway, so 16-year-old. But so when you say children, is it up to 18, or is it younger children that you're really focusing
We
on?
don't have, we don't, so for us, it's not like a hard cutoff age.
Mm.
It is more so what's most appropriate and beneficial for the child,
Yeah.
young adult to adult. We have, like in Midland, we have a 31-year-old who's been with us since she was 14. Now, she will, very particular, it's just physical therapy with Adam. She followed him when he had left us for a little while, but it's that relationship, it's the skill set, it's the knowledge. She works best with him. But there comes a point oftentimes of, as you're looking at vocational, as you're looking at potential continuing education pieces, as you're looking at independent living, that's not what we train our therapists to be really freaking good at. That's the goal. We like to build up those underlying skills so that then when we want to go look at more of those daily, like adult living skills, they have a foundation, but they're going to be able to have a better situation. Take like occupational therapy. We do not have a model where our occupational therapists work in the home. And if you're working as an adult individual who is moving like into a independent living or supported living situation outside of the home, or even in the home, to be very honest,
Yeah.
being able to get into that environment is so much better for those services. So, and then also working with someone who understands that system a whole lot better, because there's just, you guys are much more educated, all of it, you all have adult kids, on what that looks like for the specific supports and pieces. So like insurance, we know that, we can definitely talk more about that, but knowing some of those, more of those supports, I mean, that's where, I'll refer back to Laura Bucci, or like she's talking about Maureen, because they kind of started some of these pieces.
Some of the,
Yes. I mean, you, they,
Yeah.
well, we
But it's-
just met, so you're now on my list. I'm
That's still
sorry.
a huge hole in this town. There's no doubt about it. That is a hole.
Because U of M just announced they may no longer be taking Blue Cross Blue Shield.
I'm sorry, say it again.
July 1st, U of M just announced they may no longer be taking Blue Cross Blue Shield.
Or Blue Care Network.
So
Yes.
so it's just private pay only?
You mean
just like
you mean
pay
the U of M, the hospital here?
Yeah.
Yes.
But
Not
it's the
Michigan,
hospital.
Not
My
my Michigan,
Michigan.
Midland,
In our-
University of Michigan, CS Mott Children's Hospital, Ann Arbor, Michigan.
What? How can they?
It's on U of M's Facebook page, yes. Because they're not getting reimbursed,
I have the letter, I just got it at work yesterday.
Yes.
There's a whole list.
Seriously,
of
and that affects all of us.
The Kellogg Eye Center, the Women's Center.
Yes.
There's a whole, a whole bunch of them.
They're fighting because they said Blue Cross Blue Shield is, they asked for an increase in reimbursements and they proposed a decrease.
Oh, you're
Yeah,
right.
we-
Oh, yeah. Oh,
Which- Which is I believe across the board, but it feeds into this conversation.
Yeah.
But it's very different this time too, because we are a very small subset, but Blue Cross outside of the protected autism services, because no one's fighting those moms and families. They're not putting that up. It is its own strip. But outside of that, we're seeing our reimbursement rates going down by upwards of 10 to 20%.
And they're saying because U of M is such specialized care, and they're the only ones who provide that type of care in Michigan, that they're entitled there, which I actually personally 100% agree with, that they, like when you're down there, we all know that the care there is different than anywhere else in Michigan.
But
Well,
just
they
generically,
they put it,
everything's more expensive.
yeah.
Healthcare costs continue to rise. So, we hire therapists, their cost of living, everything goes up, costs more. In no way can you justify paying less. I mean, these people need, so they may be on differences, but wanting a 10% raise and getting a 2% raise, let's talk. But yeah,
I would, and
that's
my
difficult.
bet, knowing how the way that we've had the opportunity to actually sit down with medical directors, I don't think it's a done deal. I think that if there are enough families and enough parents that rise up on this, it will be very interesting to see if U of M will not come back and try to see what they can do to negotiate an agreement, because it's not going to be good for Blue Cross and it's not going to be good for the hospital. It's not good for either side of the equation. So that's where what I have learned over time is
The triangle.
Yeah, but a lot of times the patient doesn't necessarily have a voice, it's their loved one.
Well, yeah.
And I'm not even saying
When I
like
say
our
patient, I
children.
mean the family, but family in general.
Yeah,
whatever.
whoever's insured has the loudest voice, because
yes, you
that's
do.
what we have learned. The insurance companies work for the people they insure, which are the businesses, and the businesses want the insurance that the families want. And they want that coverage. So when we, as we fight with Blue Care Network, one of our biggest hurdles is Michigan State has been a bug in my butt since the beginning. We got them to include the autism law. They got some of those coverages because they're not required to. I assume you guys all know all of that. I don't
We can talk.
want to ever judge knowledge, and if you don't have children with autism, it might not be as versed. But they now have stopped covering just most other conditions, diagnoses, and things like that. So the fight is not with Blue Care Network, it's with Michigan State, which my response is just, so how many professors do we work with who are very upset by this? And they continue to work through it, and now working with their unions.
But what we're talking about is there's so many components to insurance, and what happens with like Michigan State is that it's a self-funded plan. So if you know what a self-funded plan is, it's like cafeteria. They can say, well, we'll take that, we'll take this and this. Well, the reason that they take, and I brought some stuff for you, but the reason they take like with the autism is because the legislation said you have to, not a choice. Every insurance company must do that, but they can then negate anything else that they
Well,
want
the
to negate.
self-funded can still opt out.
I think they can, but
Yeah.
nobody is that I'm aware of is doing it
Nobody
because
wants
of the
to
law.
anger their staff that much.
One of the things that I think is, and of course I have not seen this because we're not tied into the U of M system. I truly think that you guys, you've got this kind of opportunity, you've got a large group, you need to start your campaign and find out who in this area is going to be the one who's going to stand behind you and fight. Because as we're saying, that Michigan wants to cover Blue Cross, they make money off of this. It's not just the services, but they need and their own employees or whatever. And Blue Cross doesn't want to lose a big entity. So this has got to go into some kind of negotiation. It just cannot be an end game, just knowing how insurances work. So I don't know what,
Is that what you got pulled up right now?
Yeah,
Is it just
so-
Ann Arbor's campus?
No, there are 19 locations.
Yeah, including
It's called
Lansing.
Michigan Medicine, and it
Yeah.
says they are demanding a 44% increase in payment over
That's
the
pretty
term
big.
of a new contract, and they are still negotiating.
There you go. See, I told you.
Right.
It's not
So
done.
it's Livonia,
letting
Canton,
parents know.
Briarwood, Chelsea, Northwood. I mean, there's 19 of them.
It won't, you won't lose it. I'll guarantee you. There's too much money and everything that runs healthcare,
Not my mission. No, it's all in Southeast Michigan.
everything that
But
runs
again, it's
healthcare is
40%,
money.
they probably want money. Right, exactly.
No, it's got to go into negotiation.
So the voices happen
Well,
now.
according to the
Because
letter,
everybody
they
wants to
have
make
been
sure
negotiating,
they
but
have
they're
good
not.
litigation.
That's right. So,
They run that.
and if you're gonna negotiate, you guys have probably done that, but you come in and say, I want 89%. Well, you're not gonna get it, but you don't want to come in and say, well, I want 40% or I want 20% because you're gonna get knocked down. So I'm not surprised. It's still in negotiation. It's gonna be an impact and it maybe changes, but U of M is not gonna give up, and Blue Cross is not gonna want to lose. Blue Cross and Blue Care Network are not the same guys. They kind of go to bed together, but they're not the same. They don't want to lose U of M. Not even at all. That's where they make their bread and butter too. So I think you've got to just determine who are your legislators, determine who is involved that can be. I'd get with the HR in Ann Arbor. I would find out who they work with, because it's a different part of the state, but it impacts you guys because you're driving down there. So I'm sorry to hear that.
Anyone that like left Blue Cross,
Well,
like
I-
our Blue Cross like shot up so high that we
I-
left Blue Cross.
We're with that now, so we're not Blue Cross.
And that-
We're like priority PPO now, through the Michigan Dental Association. I don't know, we didn't check with, because we haven't done therapy outside of school, but, I don't know if you guys take other insurances besides Blue Cross.
It's
but-
not
We do.
us taking the insurance, it's the insurance covering the concern.
Well, choosing, okay, so.
Yeah.
We
What
do have.
they partner with or whatever.
No, it's so,
They'll bill, they just don't know if your company.
yeah, so you'll get a lot of
Right.
insurances who just don't. Now, autism's typically a covered diagnosis, but there's a lot of insurances. Down syndrome is one that's been around for a really long time. You will get the majority of them that will deny the
Services.
services.
Uh-huh.
Most
Even cerebral
diagnoses
palsy.
out of that we still get issues with habilitation, so you'll get developmental delays. A lot of insurances outside of Blue Cross, fortunately, unfortunately, are just denying. So there's nothing we can do. We have contracts, we do everything. We've actually, the reason Blue Cross covers kids is because of the application she did back in the early 2000s with the support of Dow Corning and
Dr. Ruane.
Dr. Rain, but
Okay, sorry.
no, Riley's not.
Oh, Julie.
Julie. Helping advocate to get those individual pieces covered. But you're exactly right, it will be great, but the fact of the matter is what we know from insurance companies, which we can see, is if they want 44% more, that just gets passed to the consumer. And then it
And
gets,
that, let's be honest, with
prices
us,
is up.
that's the employer.
That
who then
you.
passes it along.
Right, exactly.
So then your premiums go up.
But I don't get a choice. I don't get a choice in who my employer chooses to work with.
That's
You know what I
right.
mean?
Right.
You know, so.
Unless, right.
So it's the employer who has, I feel like the employer has more control, because mine, for example, with my husband and I both have health insurance obligations. My employer is self-funded. I choose not to work with them because I don't wanna pay $20,000,
And then
which is what and $9,000 for my deductible, you know what I mean? Which is fine, I had a medically needy child, the numbers didn't make sense. My husband, we don't pay for his health insurance at all. So we choose that one, but it's half. There's not as many people who participate with half.
That's right.
So my network is very limited with who we can see and who we can't see.
Right.
Yeah.
Now, if we didn't have Medicaid as a backup, we would have been pre-bottle up.
Well, and let's kind of step back a little bit, because I think you guys have got a lot of really good issues. I think one is that when you are looking for a plan, now you have to, in this, especially if everything is going on and all of the cuts to Medicaid, the cuts to the CMHs, and we're in CMHs across the state. There's just cuts all over the place because of what the federal government isn't doing, whatever. When you are looking at a plan, one of the first things that I can share is that even if you have an adult that is in your home, there is, and I'm just going to say it, and if you guys all say you got it, then we'll go on. Are you clear on the difference between habilitation and rehabilitation? Okay, I'm not seeing any faces moving.
In terms of the waiver or?
Okay,
Are you talking about, we don't have
Coverage.
Medicaid or anything, so we only have private insurance or like,
okay.
but.
Let me divide those for you. So what actually came out, and a big part of that was the Affordable Care Act, but some of this went through, and let's say if any one of us, God forbid, something happens, you have a skill, you lose that skill. We're going to do rehabilitation. And rehabilitation is, there's an episode of care. There's an episode of an illness, an injury. That is what is rehabilitation.
Up to the point of date of injury. So the skill set you were at is where they would try to bring you
Right.
back. Get
Okay.
their
So an example
rehabilitation.
would be
Back
like,
to your baseline is how I
Yeah,
understand it.
so
Right.
you
have
break
knee
your leg, you learn
injury, like,
learning how to walk
right,
again.
and you
Right.
have knee surgery, and then what they're doing to bring you back to
Correct.
where you were before.
That's rehabilitation.
Previous
Right,
level. of
exactly.
Okay. So, but the majority of children, there is no episode of care because it's a developmental. We're not certain what happened. There can be a diagnosis, there can be those issues, but it's not typical that your children, adults, you could say that was the day it happened. Now, if there's an auto accident, whatever, but something, they came into the world,
Right.
you know, these great little babies came in, and there's no definitive diagnosis issue that happened. Okay, so habilitation came into being, and that was a big part that came in again with the Affordable Care Act. And talking about that, habilitation is, we don't really know what happened, but they are not developing along the continuum that they should. And therefore, we need to provide habilitation coverage. And I'll say that over and over and over. You can look at your plans. And MSU is one of them, but that's because we're in Lansing. But if you look at your plan, it will say, oh yeah, we have speech and OT and PT. Now dive deep and find out if it says, what's the diagnosis? There's where you get caught, because more times than not, it's going to be an episode of care that it was, what was the trauma? What was the injury? What happened? Now, what we get, in fact, we're fighting, and right now with Blue Care Network is, and we're working with the head medical director of Blue Care Network.
They changed their whole medical policy based on.
They did for the
years we
speech
worked with
because
them.
of, I went to them, and Matt and I went for about 5 meetings with data like this of what was going on, and they revamped their speech policy. And what, I don't want to go too deep into that because I want to stay in the rehabilitation conversation, but they started to look at severity. So what we would go back and we would say, well, look, we got a 3-year-old who is functioning and skill sets are like at 1 year of age. This is severe. Now, we can't give you a standardized test because, well, they're 3 or they're 7 months or whatever. So we were able to go back and get that changed for the speech pathology. Now we're working on the OT and PT because what they keep coming back and saying is it's congenital, chronic. We do not cover developmental. Now, has anybody ever looked up what the definition of chronic is?
No.
I don't know a lot of children that have heart disease, diabetes, trying to think of some of the others. If you look up, that's a definition of chronic. And they're sending us these denials for kids with OT and PT. And it's saying, well, we don't cover chronic / congenital / developmental. Why don't you just throw the kitchen sink at us? So that's what we're fighting now. And what has happened for us with Blue Care Network is this pile of stuff I took to Blue Care Network with appeals that I did for children. And I went back and said, wait a minute. And we got probably 95% turnover of those appeals. Now, most places can't do that. They're just gonna say, oh, you got a bill? Well, then you go figure it out. Well, you don't know how to fight that.
They choose not to. They have the exact same.
Other,
skills.
that's true, but I devoted a significant amount of time on this and it got turned around. Well, now we're working on the OTPT because again, and even Dr. Graham, who we're working with, said, how can you say this is chronic when it's 7 months of age? How can this already be considered chronic? So, and what this is, and so as you look at your insurances, I don't know if you're aware of this, but they're like these gatekeepers. So here we are, the provider, and then what you got with Blue Care Network, not Blue Cross, Blue Care Network is Evicor. Have you ever heard of Evicor?
Cross is now switched to Evicor, just not.
Well,
Cross.
yes. Okay. Do you know what Evicor is? They make. I'm being recorded, and I don't care. Send it to Evicor. We've had meetings with Evicor, and they're out of California. And what happens is we submit. They will pay for the evaluation. Evaluations, we had to fight that years ago. Evaluations are already paid. Then we have to say, okay, now we did an evaluation. Based on that, we recommend this service. We recommend certain number of sessions or whatever that we want to work with the child. It doesn't go to Blue Care Network. It goes through Evicor. And Evicor is the dumbest thing I've ever seen. Because what happens is that I've said this to Dr. Graham, when they stop it, and they're supposed to review these, they stop it and say, we deny it. It doesn't go to Blue Care Network. It goes back to us with a denial. It goes back to the parent with a denial. And that's when we've had to appeal. And then we go to Blue Care Network and Blue Cross and they say, what do you mean, Janet? What's going on here? What do you mean, Janet? Matt? Well, let's talk about it. And that's when they came back, and that's now what Dr. Graham said, wait a minute, why are we putting this through? It's a template letter. And what I think is that families, it's very hard for a family to know how to fight that, because we have to go back and we will, the OT, PTs in the company, Annie and our head OT and PT, and then I as a speech and language pathologist will write those letters of appeal. And the percentage of turnover is huge. If you don't have your professionals helping you on that, you don't know what to write. And I'm not saying you're not professionals. You are professionals with your children. But when it comes to fighting insurances, so it's a very challenging thing. But let's go back to habilitation. I'm sorry, I'm feeling like I'm doing squirrel. So habilitation is what you have to look on a plan, is to see whether or not they're going to say, based on the needs of your young adult, are they going to pay for it, or is it they're looking for only rehabilitation? If it's only rehabilitation, and I don't know the cutoff because I'm not fighting insurances with 25 or older, you may get back that it's considered a developmental and it's not going to be covered.
It's interesting. Yeah, when I was reviewing the priority PPO plans, of course, there were, there's speech and everything on there, but that conversation with the agent didn't come up at all.
No, Brett.
So what we see is it's called the benefits ed plans. We used to sell health insurance. I used to sell health insurance.
You get the one page.
So the benefits at a glance doesn't even mention habilitation because it's buried, I feel like, and you only get the 3-page synopsis of what's covered in the plan. So you see speech, 20 visits, OT, 20 visits.
But you should see somewhere on your plan if it says rehabilitation, and I'll tell you, Priority Health is not a fan of habilitation.
No.
Well, luckily I'm not too worried about it because like I said, this really, my son is 18 now, and this would have been really important to me maybe when he was like 5, but we probably don't need to pursue services at this point, but I do feel for the parents that have younger kids.
It is very, very hard, and there is, and if you want, I can show it to you, whatever. There is a significant difference between educational based treatment and therapy in medical based. It's not the same. And we may all get our degrees from the same location, but how we look at what are the needs They are very different of where the schools are going to come in at one component of how you can perform within an academic setting. And we're going to come in and we're kind of doing a deep dive in a different direction, looking at what is the underlying that's causing this. So very different. I'm not trying to go that direction right now, but any more comments about the insurance? Look at your plan, talk with your HR. They could put on, even if it's a self-funded, and even Priority Health, they could put on a habilitation rider.
Let's
could
just
add it.
clarify, if it is not self-funded, it has to have the habilitative rider. It's only self-funded that have opted out.
No, I wish I could say that's true, Matt, but not, no. No, so you need to check. You need to check 100% because we even have Blue Care networks that will say not an MSU plan, but it will say that habilitation has been excluded from the plan and they are not self-funded. You have to deep dive. It's not going to be written where you can easily see it.
Most of the time, we don't get a choice. Meaning, like, I only have one employer plan
That's right.
to choose from. I have my husband, and if I'm lucky, I have my plan and my husband's plan. That's it. That's the only, and their open enrollments are at the same time, so you don't really get two
Helpful.
choices. And most plans, as we both know, do not coordinate benefits anymore. It is, we will refuse to be secondary because it costs the employer more money and it costs them more premiums. So how do you really make that choice, or how do you really make a difference? Does that make sense?
It does, and every time you are working with your company, with your HR plan or whatever, it's hard. I'm not saying this is easy. Good Lord, there's a lot of gray under here, but thank you for my woman who does my hair. It's not easy, and you've got I wish I could say it's not. It's now an economic challenge for families. For all of us. It is a fight to find out what your company will provide and see whether or not it's there. I wish that I could say that that's always true. You've got to go see whether or not they will include in what they will do with habilitation. And habilitation then says that if your child has an issue that we don't know where it came from, but we know that they're not following the lines that they should be, that would go underneath that type of inclusion. But it's a fight. It's nothing but a fight out there anymore. And that's what's hard. And you're right. A lot of families, this isn't, can I choose all of these different options? Because as a company, we also have to provide insurance coverage for our families. However, if we have an employee who has a child with some needs that are not being met, I guess we got it covered. But it's hard.
To maybe answer yours a little bit differently is I kind of think of it in this world as like we're talking about an IEP versus all the work that happens to the IEP or the time we're picking insurance is when everything is selected. So the time to have the conversation is throughout the year, months before open enrollment, because as the owners of a company, we sit down, you've sold insurances, you sit down with you sit down with your person who's selling you the plan, and you can ask those questions, what you want in the plan, what the additional costs will be. As an employer, the only thing we can do here at this point would be take away the level of ignorance and educate them of what would make a difference. So our world is obviously the habilitative rider. It is obviously from an autism benefit, because as we talk adult children, most of those benefits will go up in through the 20s, mid-20s. Once again, getting the clarity on what that looks like for that specific plan, because there's no longer one answer. But the more the conversation can be had beforehand, or more like, I don't know the size of the business, but that's, it's the difference of having the conversation, because like we have 140 employees, but any one of them will come in my office and ask a question. I was just talking about our healthcare with 2 staff yesterday, as they're getting married. So it depends on what level you can have the individual conversation, or what level it is that company, like the parents coming together to have a better knowledge to then present one united information. And just the request, just the question, because oftentimes the cost is minimal. And I can give the example was the reason Blue Cross covers children in the state of Michigan was back in the day, it was 20 years ago now, they wanted the contract for Dow Corning. And Dow Corning was on Dow Chemicals health plan. And they both worked with us on a very exclusive line item just for Midland. And so we had a lot of families who at Dow Corning were concerned about losing this coverage. So we had the mom, what's her name? Julie DeClaire, who worked at Dow Corning, and basically she was in charge of helping set up the contract. And Blue Cross, the whole deal was, well, I don't want to lose this coverage for my kid. And Julie had asked Janet, she said, yeah, it looks like in the plan you're not going to have nearly the same level of coverage. So that's how we got introduced to our first medical directors, and we sat down with them, and recorded or not, basically they said it was not that expensive. They are. It was not that expensive to them to cover the needs of these children versus the loss of that opportunity to
They wanted
get
Dow
these contracts and to be known as healthcare that covers families. And Dow Corning, I still think they pride themselves on being known across the country as a place to work if you have a family. And one of it was, I don't remember, it used to be they were one of the top 10 or 50. And, oh yeah, that's
let me-
Yeah, my
it's
parents
quick.
both worked there and they were a
Gone now.
wonderful company to work for, yeah.
The other part, let me share with you is, and what's the big insurance that's up in Traverse City that does,
Priority Health,
does all the cars in that.
Haggerty.
Haggerty is known nationally. You know what Haggerty is? It's huge. If you got some big fancy car or whatever, they're gonna insure it, boats and all this other stuff.
Insure expensive
It's
oddities.
very, very big company. Okay. And I happen to be on the board of directors for Family and Children's Services in Traverse City. So two of the board members are HR for Haggard. And so I went to, and one of them, we're looking for a new executive director for the agency in Traverse City. And one of them is in HR. And she and I were having a conversation and finding out what I'm doing. And she said, we had an employee that we really wanted, but we couldn't keep them because we couldn't offer anything with kids with special needs. And I said, want to talk? So then we added a new person on the board, and she also is one of the presidents of Haggerty. So now I'm going to sit down with these two people, and we're going to talk about, because I asked them, I said, do you know what habilitation is? No, what is that? So I think Matt bringing up a very good point. It's like if you're going to do an IEP, talk about it beforehand. Don't wait to get into when you're in the meeting. You guys learned that over time. Plan it, know what you want. What is it that you need to do? Do the same thing with your HR. Do the same thing with your companies. If you can go and have a conversation and say, do you even know what habilitation is to cover? And you fought insurances like crazy. I remember you sharing some of that. And what happens for you is if you need more specialized care, it comes out of your pocket. It's good, you're paying things privately. Insurances are not easy. It's getting harder. It's getting harder even as employers, because here, we're kind of on both sides of the fence here to make certain that we give good coverage to our employees, that they've got what they need. It just so happens in this area, like I said a minute ago, that if we have an employee who has a child that needs some extra assistance, well, come on in. But it's hard. And I know it's not really answered. Each one of you are going to have to deep dive into your own plan. You're going to have to deep dive with your company. You're going to have to deep dive with your HR. You're going to have to go and say, let me ask you, do you have habilitation coverage? And I will bet most of them are going to go,
What?
What's that?
But it also correlates perfectly to what is our plans for the loss of the U of M coverage. Are you looking at potentially switching? What are we, because they could very well be unaware as well. Like you said, open enrollments are all over the place. So someone may be already getting those memos to be doing something for September or June or July. And that information going to an employer, because I know if I had that question, I would then be reaching out to Deb Nielsen over at Valley United, who does our insurance plans, who then she's gonna reach out directly. You're gonna create the funnel of information that creates the level of concern. Because, I mean, you guys are on both sides. You want U of M in your network. You also want to be able to afford the health insurance that has U of M in the network at the same time. So it's a give and take. Hospitals and a lot of healthcare, we're in a very weird space. Our reimbursement rates have gone down since COVID, but we have seen hospitals just spike in their expenses, their reimbursement rates, even some of what their pay and such has spiked too. But just getting yourself educated, but more so those people who make the decisions too.
So let's say there is an event, and this is the hard one for me to understand. And I know I'm derailing your goal.
There's no goal, it's to help you.
So if we're seeing rehab inpatient versus outpatient, are those different rehabilitation rates
Different reimbursement rates?
to
for you
the,
guys?
Yeah, we get
Yeah.
a lot less.
oh, yeah, the hospitals
Well,
have much more
reimbursement, yeah.
negotiation rate than, and they get much more than we do in an outpatient. Oh, by far.
No, outpatient is, so,
Go
But
look
let's
at an
clarify.
ELB and you'll see that one.
because you can have
Yeah.
inpatient and outpatient, but if it's an outpatient attached to like University of Michigan, also a higher reimbursement rate than us who just get the generic
Right.
outpatient reimbursement rate.
My Michigan here in Midland, the pediatric rehab there versus your pediatric rehab, they're getting reimbursed more than you are.
Typically,
Interesting.
I
You know,
can't
you're-
quote on their individual
Right.
negotiations, they could
My
sign.
Michigan doesn't give you the EOB. Like I might, meaning like I get a monthly statement saying you owe $3,000.
Well, your
Well, your
EOB comes
insurance is
directly
fine.
from insurance, yeah. So,
Which. Yeah, so I do realize that, but,
but
I think
typically it
that's
would be at a
like
higher,
less, okay.
yes, we typically will get reimbursed less. But like if you go to any outpatient who just have a generic contract, it would be the same rate. But a hospital, just like you are more educated than us on, U of M is trying to negotiate their own rates up
Mhm.
disproportionately to what Blue Cross has seen an increased rate for a hospital reimbursement, which they're trying to claim specialization. Everybody I met goes to U of M because of those skill sets. Now, if they're really at the same rate or if it's already a disparity, we don't have that knowledge. None of us will ever know. So we'll leave it to the powers that be to see how these people can agree, because everyone knows healthcare typically feels underpaid, under recognized for their services. And healthcare right now, I don't know where all the money's going, but it's gone. And they just keep raising our reimbursement rates. Now that's obviously the more people use their healthcare, and I think we've seen a big tick up in that.
But I'm glad to see that what you're reading is, and I'm not surprised by that. It's a negotiation
Yeah.
that's not done. Neither side wants to lose each other. So they'll be at the table.
I feel like this is
But-
like a YouTube and ABC thing.
It's a very good
Yeah,
thing.
it's, you know,
Like
yeah,
it.
But it's good because what it's gonna do, it's gonna get families involved in this and families are gonna push, and that's needed.
But I
and
was
that's
gonna
what I was
say,
asking for.
But the My Michigan just went through the same thing, where they are not accepting, the Dow retiree Aetna, blah, blah, blah.
Mhm.
And they never did reach an agreement. So then My Michigan just basically said, yes, we'll accept your insurance, but if they don't pay. So you have to sign a waiver that says, yes, you recognize that, so that then they can still bill you.
Yep.
For any
Balance.
balance bill you for anything over what Aetna will pay. So it's like, that's kind of scary because you don't know what that means then and how much money that
Yeah.
could be, you know. So
You know,
you're
that's,
insured, but not really.
that's right, and
That's the American way.
everything going on with insurances right now is just, it's tumbling on itself, and it's people who, it's just tumbling. You can see what's going on with community mental health with all of this, and I'm not trying to go political on you, but keep aware of what's going on in the political nature out there too, because it all will trickle down, and it is, it all. I think
Fun
you started to
stuff.
ask a question a while ago, and I don't know if you got that.
No, I just wanted to say something about I'm sorry, insurance fine print. We had a group meeting here yesterday and we were talking about the ease of reading the fine print these days.
It's
With,
a lack thereof.
no, with ChatGPT, you can
Oh.
download the entirety
Oh,
of
that's a good
the
point.
plan from Aetna versus Blue Shield versus Blue Cross, put it all in ChatGPT, explain the needs of your child. She needs 6 OT sessions a week and 6 PT sessions and 2 music therapy sessions and blah, blah, blah. All of that, which plan would work the best? Look, one click of a button and it takes 10 seconds and you get the right answer.
Well, I
So-
need to find out what that site is, but one of your challenges also is that your plans will also tell you your visit count.
Your what?
Visit count, or how many visits can you have in a year?
Yeah.
And
Well, ChatGPT would appropriate that, if
Yeah.
it's like twice a week, ChatGPT would come back and say you have 60 visits, so it would,
Right.
it probably gave them the date of when services would conclude even.
Yeah.
Yeah.
So
AI is
basically, it's easier to go through all the fine print these days, something that was really challenging before. And also for all of our families, it's not a typical, I would say, person is taking an insurance plan with planning for the unknown. With our children, we know
No.
what
That's
they
right.
need and how much or how many expenses we'll encounter a year.
Yeah.
So all in all, it's much easier to kind of decipher through the data and choose a plan. And given that we all are hit by the increase of the pay and
And the part,
So, like,
and the part that's
but
very,
we can choose wisely.
well, the part that's also frustrating to me, and so I want to say this well and not have it misunderstood. But I'm frustrated with the coverage that children with autism get. I want every child to have that coverage because
It's a
a
disparity.
lot of, it is such an unfair disparity because there are a lot of visit count of 30 or 60. There are a lot of insurances that there's unlimited visits for children with autism.
But
And that's hard. I wish every child could have what they were able to achieve. So,
there's a lot of nuances to that. So I had a child with autism. We were in New York when that first started. And it was every change to your plan got a copay. Every time we would meet, got a copay. So anything that changed on that plan, they tacked on a $25.
was that in New York or
That was
here?
in New York.
See, but
But-
this was Michigan law.
But I'm not sure what they're doing. I mean, I don't know what they're doing here, but I imagine that insurance is kind of caught on to that. And every little thing gets.
Well, they're going to come back and do there, and that depends again on the plan. But what happened that was and I think it was 2012, that was Michigan legislation. That was Michigan law. That was then if you have a Blue Cross, it's Blue Cross of Michigan, which is not Blue Cross of Illinois, not Blue Cross of Indiana. They are all separate. And everything that happened with the coverage for children with that diagnosis was in this state because the lieutenant governor
Brian Cap.
has a child with an autistic diagnosis and things just started to move. So again, don't,
Insurance is mandated at states.
it's a state law
It's a-
mandate.
I mean, well, all insurances, so your home, everything,
Right.
so like when you decide what gets governed by the federal government or what gets governed by the state government,
It's a state-
insurances are state governed
Right.
thing, not a federal government
Right.
thing. So that's.
Unless
the reason
you're
there's so
like a
many
Medicaid or
issues
something.
around.
Right.
Health insurance is because you have 50 different governments getting involved because every state has their own. It's the state insurance commissioner of every state. So that's the reason, like we talked about universal health care, like Canada is one entity. In the United
1/10
States,
of the population.
that one I didn't know, but in the United States, you're not just getting the federal government involved. You're getting the 50 different
Right.
state governments because all insurances are mandated by the state. That's part of our
And you
civil
get
war.
both, yeah, you get
And one of
both.
the things that
Right.
was decided.
So I can't speak to what was going on in New York. I know that Dr. Solomon, who came in
I
the
can
play
speak to
project,
the
was in
part.
Pennsylvania. So I can't speak, God let him get, I don't know what was going on in New York. I can only talk to what's going on in Michigan. I just wish that all children
Yeah.
could have the opportunity that those children have, and I'm glad they have it. I'm just frustrated that other kids can't have the same type of.
I mean, we had the
Right.
same thing for years. We were developmentally delayed. And until I got an autism diagnosis,
That's
I'm not even sure if my daughter really is, I mean, she's kind of like borderline on the spectrum there. But until I got that diagnosis, we got nothing.
Denied,
It's like you're developmentally delayed, you could catch up, so sorry, it doesn't cut it.
And in Michigan, we were not allowed to list autism until the bill passed because I could get some coverage, those 30 visits, 60 visits. But as soon as I put autism down, I got zero because autism is no longer a covered diagnosis. Development delay actually, up until that bill passed, was the way we had to run it in Michigan because if you knew of an autism diagnosis, you had to put it down and then you would not, it was no longer a covered leading diagnosis. So your Blue Cross and such would still cover those developmental delays, but
That's weird.
Well, it's so opposite of what we know now, but people
It's-
remember pre-Obamacare versus post-Obamacare.
It's changed.
yeah, there's lots of
It's so much.
nuances. But yeah, I've been a speech therapist almost 20 years, and what you could do then versus what you can do now and what you can do in the middle, it is the same kid has to be represented so many different ways to get the most coverage. I have played with codes as best as you can to represent what you can work on because that's what will be covered. Some of us have good at
Well, let's because this recording is not gonna understand what you mean by play with code. You can't. We're seeing what's appropriate,
That is.
but you definitely can't just
what's
grab,
covered.
right, you can't grab a code because that is insurance fraud.
Of course, but you can choose what to cover based.
Yes,
You
exactly.
choose what to treat based on what is covered. So you can work on different things, but there's areas this is not something that'll be covered. Insurance isn't going to pay for it. I'm going to build this and I'm going to work on these areas, and those are the priorities. But like with the co-pays, that is a game that insurances, I think, play. New York is one of the leading models as you talk about the 50 different representations. New York and California and Colorado, when it comes to autism, are the three highest that the state of Michigan appears to try to model off of for their healthcare coverage. So those pieces, I know what you're talking about because we see that sometimes from Blue Care Network takes that model of, we typically will see it as a copay per day, but it adds up pretty quick. So it's oftentimes easiest to just walk to a family or chat GPT to give more clarity. Is you're best to assume your max out of pocket is what you're going to spend. Now let's walk this backward, because if you have ABA or something, like we'll get kids who come for ABA, speech, occupational, occasionally physical therapy. And they may be coming for 25, 30 hours a week. So that $25 copay hitting 5 times a week, when they really look at it, it may max out at $5,000, $8,000. When they look at 25, 30 hours of skilled services for 50, 52 weeks a year, comes out as a very affordable to them, but very much something you have to prepare for. I mean, that's often where we have programs where it's like you almost have to model a preschool type approach. Not that you're doing preschool, but you're teaching some of those skills. You're integrating individual therapy versus group-based intervention. You are working through, we even have things like we call circle time or recess. So you're building in those skill sets because these kids who need this intervention are going to miss sometimes those other opportunities, or they'll be in a hybrid model. So we'll take kids 5 days a week and then they start going to preschool 2 days a week. And it's really fun to watch that engagement levels. But it is, if I'm not mistaken, you're really talking about how they just try to nickel and dime you to the point that it gets expensive too, because that's 100% true. And
The other
ChatGPT, I love them. That's my takeaway from today is you can really plug that in and probably get a good feel for what your insurance would actually cost you. If you can get your parameters accurate and what you're asking, that's my only problem with ChatGPT. If you ask the wrong question, you get the wrong answer. But
Yeah, or if you don't know what question to ask.
yeah, and you can't ask ChatGPT, what should I ask you right now? I've tried.
There are different ways you can get on there, and you can even go and look at, you can put up priority health medical policy for speech pathology, or priority health medical policy for occupational physical therapy. The other part, though, that we keep very close contact or keep close watch on is you've also got some insurances that say you've got 30 visits. And if you do the OT and the PT, it depends on, if you do the OT and the PT on the same day, it's one visit. If you do the OT and the PT on 2 different days, it's 2 visits. and you're using up visit counts faster. So
The term is if it's a combined visit, is what
Right.
you're describing.
and so there's so many things that you have to look at insurances that it's overwhelming. And like you guys are saying, you've got different issues at different ages. You've got different issues with different insurances. You've got different issues with whether or not you even have an option. And it's very, very frustrating for you as family members. And I'll tell you, as running a company, and I'm not, knock on wood or whatever. I think the reason that we're still here is because we have fought every insurance every time. And I'm just right there in the middle of this stuff. And why don't you? And what's this? And what can we do? And what Matt's talking about, even with when we brought in, and we're sitting at a table with the head medical director of Blue Cross, person who's doing all of the contract negotiations, sitting there with the HR of Dow Corning, and sitting with his family member, all in the table in this little office over here. And it was just fascinating to watch this dialogue that was going on. And I'll tell you one quick story on this. So we're sitting there, and we always have to get a referral from a pediatrician. Insurances don't make sense. In fact, we tell our billing department, if once you try to think logically, you're going to lose your head. So we're sitting at the table, and I have Dr. Ruane, the head medical director, and I have a person from, I don't know what her position was, but I can remember her face. And then I have the heads of Dow Corning. And Blue Cross wants this contract. And what Dow Corning said is, if you don't include Children's Therapy Corner, we won't take the contract. Thank you, Lord. There are things that have happened. I can't explain it, but I'm just going to say, thank you, Lord. And so what happens is they're sitting in the meeting, and the contract, Kate Simon says, are you willing to sign this contract? And I said, I can't. Now you could hear the room just got hush. And you can just see the everybody going, what's the deal? What's the problem? And he said, well, let me share with you what Blue Cross will require. And Dr. Ruane sitting beside me, and I grew up in New Mexico, so it was not been bad, but I said, Dr. Ruane, it will be a requirement that we have to hire a physician. We have to put a physician on staff so that any referral has to go through the physician. I said, Dr. Ruane, you're a medical director. I get the referral from the pediatrician. And it doesn't matter to Blue Cross if the doctor that we hire to review this it could be a podiatrist. It could be a dermatologist. Doesn't make any difference.
MD or DO, that's all that matters.
Anything.
The initial with you.
That's right. And I said, Dr. Ruane, where I come from, that's called too many indigenous and not enough. Who are we supposed to listen to? Do I listen to you, Dr. Ruane? Do I listen to the referring physician, or do I listen to the podiatrist? Who is in charge here? And then I turned to the head of HR at Dow Corning, and I said, do you know who's going to pay for this? You and me. And the head of HR at Dow Corning says, is this true? And I remember this young lady saying, no, that's not true. We wouldn't require. Kate Simon, who became a good friend, and so is Dr. Ruane. Kate Simon said, Janet's exactly right. That's exactly what is going to be required of Blue Cross, is we have to hire another physician to review any of this. And at that moment, Blue Cross changed their plan, and it was no longer a requirement. That's the kind of stuff that I just.
They changed that for everyone, not Children's Therapy.
No, it was changed across the state. But those are the kinds of things that it's so hard to know how to go fight. It's so hard to know when you have these opportunities. But it was the kind of thing of I can't afford. And they thought, well, is the rates not enough? I said, no, that's not it. And then when I explained it, then it was, well, that's really, really stupid. Why is that in our plan language? Well,
Yeah, they
I
should
don't
just be
know.
listening
It's
to
your
the
plan
referring
language, not
doctor,
mine.
Right, the
Huh?
referring doctor is who knows the patient the best, right?
And then
So
it
why
would
are
go
you
to your
thinking-
head medical director.
Right.
So that's the kind of part is that I wish I could tell you the key ingredient that when you're talking or you're looking at your insurances, it's so hard. But I hope that families, and I don't know who all will have the opportunity to listen to this, because I know we've been talking for a while and I'm loving the conversation, so I don't want to overstep our time with you guys. Get out there and advocate. Get out there. You are professionals. Don't ever sit back and wait or look, not that you are, that you're thinking that the professionals are going to do all of the fight for you. I wish I could say that we do, but that's not consistent. You have voices that are absolutely huge because you are the ones who are with your young adult, your children. You are professionals. Don't ever get yourself into a situation where you are in a therapeutic situation and you don't have a voice. You should have the biggest voice in the group. And work with your HR, work with your, if you're going somewhere for out of school services, go talk to the people who run the company. What are you going to do to help me if I get a denial? What are you going to do? How are you going to help me? What do you see? What should I be looking for? That's not going to be true of every company, but as far as I'm concerned, if every family would push, every company will get their poop together. And it's needed. It's just needed. And I don't know, we were talking a little bit about when will I retire. I don't know that I'm ever going to retire from fighting for kids. I've been doing this for 30 years and I don't know that I'm ever going to stop because it just keeps changing.
Well, and your knowledge is so detailed, it's not replicable. Because you have that, like, and I look at it for my business, you know how it was 20 years ago. You can't teach how it was 20 years ago, because so you've seen the evolution, whereas most people only know this is where they are now, and that's good, but they have to understand, and they don't understand the context of where it came from. Because we are in a better situation. Than
Well, and I think the other part that's hard is that we have a billing department. There are a lot of places that you will go, and they're going to hand you the bill, and you go bill it. And you go see if they pay for it. And if not, then you take care of it. And that's never been how our company has operated. So I think that I'm in the middle, and now Matt as well, in the middle of all of this insurance stuff. Because when we started, I would watch families who were they were taking their home and they were getting another loan on their home. And I thought, this is wrong. This is just, it's wrong. And that's been our goal as Children's Therapy Corner, is that we want our therapists to go do your work well, go see what this child needs. Don't do your own billing. Don't figure it out. We'll go figure it out so that you do what's the best for the child, and we'll go do what we can so you can continue to see those children. And it's kind of like getting malaria. I don't really ever wanted to learn it.
You've had malaria?
Well, I feel like it, but you know what I mean? It's like, I didn't really want to learn this, but we have, but it's constantly moving and it's
So
hard.
what's Children's Therapy Corner the best at? What's your niche?
What are we the best at? We do the best.
You have, I don't have pediatric anymore, but. And
No.
I see your service, see, you could not do what I needed. So, when I tried to switch to Children's Therapy Corner from the hospital here in Midland, you guys would not provide services at the same location for PT, OT, and speech in one day. That's what I
They were
was
just
told.
probably full.
Because the therapist who you had, because I was in Freeland.
Sure.
So the physical therapist was not in Freeland the same day as the occupational therapist was not in
We
Freeland.
don't have a
That's
problem
not us.
feeling.
That wasn't us.
No, all of our services are in one
I
house,
have a
5
copy
days
of
a
that.
week.
Yeah.
Fridays a little stuff. It's right on.
By
Like Gavin.
yes,
but-
by Gavin.
Right across
Yeah.
Okay.
Yeah.
So
We're all-
I apologize.
You're good.
No, I feel really bad that wasn't us.
That's part of our foundation too, is,
Autism, either. My kids did not.
and most of our clients don't have autism. We are the only true pediatric clinic out there that will work with non-autism anymore. Most of them have removed that from their service because it's more hurdles. I have autism, I can bill it, it's straightforward, I get more visits. Business wise, it makes the most sense, and that's why you see autism clinics everywhere, because I get my authorization easier, I get more visits per client, so my reimbursement per person is higher.
But we started before autism had.
But if you ask what we do, we service all kids. And that's a niche generically, like we do it all in-house and all that. But if you wanna know what makes us different is we're really freaking good. We do the best therapy.
We're not.
And that's what we are known for by professionals and by families. So we'll have issues from billing to scheduling to logistics to whatever. But when it comes to the quality of therapy provided, we are extremely well known by our physicians. And we are extremely well known in the communities by our professionals. So
So how long do you retain your average therapist? Because
It's-
that's how I measure. Because let me tell you, we all know that if our PT person or our OT person or our speech person is leaving, we know how challenging that is for our loved one.
But it's very challenging out there
Yeah.
anyway, because, and I don't mean anything by this, younger people move, they switch, their
Well-
switches. There also is that, we work 12 months out of the year, we don't do the
They go to
school
the-
schedule.
Yeah,
And
you're evening day, afternoon based probably.
We're just
because
a
that-
normal job,
Well,
like 9 to 5:30 is our average therapist or whatever it is. We have some who work early mornings. Their first year or two, they do need to work later because families need after school options. But the majority of our staff who leave are due to school schedule or leaving the area. We will have staff who will transfer to another like outpatient clinic. By far the majority of them have left that job within 12 months because they have to learn. And I'll be very honest, to be the best quality, we expect the highest level of knowledge and skill. We continue every day walking in and getting better at what we do. Very honestly, not everyone wants to do that. So your question about retention, within 12 months, you get a really good feel if they're going to make it. So we will have a retention loss for people in the first like 12, 24 months. But we also have staff who've been with us. Our very first speech therapist we ever hired is still working for us.
That
But,
Tracy, no.
No, Tracy's still there,
Tracy's
but no,
still-
Julie was,
Lori's still there. Or did she retire now?
she's not there right now. She's
Isn't she OT?
She's OT. She's moved to more of like an adult base.
But she was there.
Kids are exhausting. Yeah, Adam's been back with us for a while.
I'm just saying, he treated my kid at my.
Like Adam's a perfect example. He tried every single clinic, and he came back and it was just, I understand exactly what it is. And this is a place you work if you want to do a really good job. You don't just go do a job. We want you to really excel because I'll tell you, a therapist with us for 1 year, I would put them up to bat against anyone with 5 years experience.
I think,
Um,
I'm sorry, but when he talks about that, we have mentoring programs. We don't bring them in and say, here's your full caseload. We
Yeah.
actually systematically put them in, we watch them, we mentor with them, and it doesn't matter if you have right out of school or 15 years. That's our expectation. The other part of it is that, you know, we're biased, but that's okay. We only do children. Now you go look at some of these places out here, either they are going to restrict, like Matt was saying, to an autistic diagnosis because it is the easiest thing to bill and get paid. Or go look and see how many of them do kids and adults. And we very clearly stated we would make more money if we did adults because that's rehab. You guys hurt yourselves, we may only get 10 sessions, but we're gonna get paid. It's like this. It just, that's why there are a lot of physical therapy places out here. Well, the knees and the hips are flying. That's the truth. So we only do kids. I said before that kids are not short adults. That's what we ask our team to be specialized in. That's what we train them in. And we train them in not just a single diagnostic category, autism. They have to have a diversification, but it is all related to kids.
And then you also work in a team, like your example, where the PT's there, and then a different day the OT's there, and then you have a speech therapist every day. That makes me a bad speech therapist. From my very first day, I was working with Adam. I was working with
Hannah or.
Hannah. Annie still works with me. I brought her
But
to
she's in
Lansing.
Lansing.
But we've always worked as that team, and then I've always worked with a team of speech therapists. Your average clinic will often even put you in island by yourself. Sometimes,
Yeah, I had one, so at my Michigan, there was 2 speech therapists.
yeah,
There's 1 PT person and 1 OT person.
Yeah.
So like they scheduled them back to back, so Aiden did have 2.5 hours of therapy at one day.
Yeah.
You know, twice a week, but it was like, if Melissa was out, he wasn't having OT because there was no other option.
Yeah.
If Becca was out, there wasn't PT at that time, this was before Adam, that's who Adam replaced with Becca. Becca went on maternity leave, and Adam came over.
Yeah, Becca worked for us.
But see,
We trained Becca.
you can
I
have,
love Becca.
Yeah.
the challenge is you can have, if
Now
you
she's
go,
in, I believe she went to Jackson.
Aiden passed, so.
but what I was gonna say was also is that when you look at any intervention, you can have the sessions back to back. It doesn't mean they're talking. It doesn't mean they're conversing and having discussions about it. And so I remember, and I've worked in lots of places, before I started this.
In Michigan.
And the one discipline's over there, and another one's over there, and another one's over there. And especially, and I'm not negating, but it's hard in the schools. You can have a therapist who's running around to all of the schools, another therapist running around. It doesn't mean that they are in the same location always, or that they have the chance to collaborate, because that's what Matt is saying. I am a better speech pathologist because of the OTs and PTs. And the OTs and PTs are better therapists because they've been around us. Because when this child is a whole being. It's not just an arm over here and a leg over here and a mouth over here. Because this system is connected to this system, you have to collaborate. And we actually call it, where we're doing what we call CAP reviews. And the team has to come together, and we don't have the speeches sitting in one direction and the OTs over somewhere else and the PTs. They're in the same areas, with the fact of, so I had to go today. What happened? What did you see? Well, I saw this. Well, you know what? I saw the same thing. So what if we, plural, what if we? And I think those things are not an impossibility anywhere, but and Matt has joined in, and I was so thankful when he came back from San Diego State. I thought he would never leave California, but he did. I sat down, and I don't think, I hadn't met Kathy yet, but I will tell you that when I sat down and I was talking about starting Children's Therapy Corner, and the people who kicked me the hardest were the families. We don't have this. Laurel Bucci came in and said, Janet. Maureen Donker came in and said, Janet. I had the family sitting down and saying, if you're going to create something, you make it so we feel that we are part of this. So we even do these consults where families walk in. There's no charge for that. Come in and let's talk about what's going on with your child. Then we sit down and say, we don't get paid for that. We don't get paid for any eval follow-up. We bring you back in. We give you the report. We talk about the report. This is what we'd like to do. What do you want to do for your child? From the minute, and then we want you in the therapy room. We don't want you out in the lobby, and then we bring your child back to you and say, oh, your child is just so happy they've had a happy day. And I'm thinking, well, my child was happy when I brought him in. So what have I learned that I can take it home and I can facilitate in a natural way? It's only been family since the day we started, and it's only been children since the day we started. And, I'm glad that we grabbed a couple of when they were a little bit younger, but, and hopefully somebody who's listening in, and they don't have to come to us.
I'm in the schools still every day. But let me tell you, like what I was telling you last week, I literally talked to 4 special needs parents just as I was showing the dog around last Friday. And I have no idea. But because they all know that this was my son's service dog, they ask questions. They're like, how did you give him a bike? How did you do this stuff? And I'm constantly, you need to look at 1 and 6. I'm constantly like, join this. And I said, can I get questions today for another person?
And I will never negate schools, but they're different. That's all. It's like McDonald's and Burger King. You can like either one. You can like them both. You can do both. But they're just different. They're just different in what and how you're looking. But no matter whether it's school, you get the best out of your school. Every school is different. It's a private clinic, you get the best out of that clinic. And if it's in a hospital, then you make certain, are they truly a pediatric-based hospital? And I will leave that one right there, and you can do with that what you want. But there are hospitals that really focus on pediatrics, and there are others who are doing it.
What are your thoughts I know, I've been.
Sorry.
Go
When you're
ahead.
done. And that's okay, you can go first. if you want.
So
Sorry, you're
basically, they just opened the pediatric rehab facility in Saginaw. So we, like, which my son did have events, like he had events. So, and when I had the choice of where I wanted to do inpatient rehab, I had, back then it was CS Mott and Grand Rapids, and that was my only two options. Well, now they've obviously opened one here in Saginaw, which for the Midland community is a lot closer than Grand Rapids or CS Mott. What are your opinions of, and I have none of the.
What all do they provide?
Your basics there for the differences, when you're looking at a pediatric, you have to go with between the quality, which we know the first two you described are higher, versus the time, which we know the wait list is 1 to 2 years. So that I know is where a lot of this funding came for Saginaw, was because of the necessity to have more options. Yes, geographically it's closer, but we'll drive to Ann Arbor 4 times in a month if we need to. But if I can stay here and not have to wait 11 months to get in there, I've now bought another year almost of development where I can be working on some of these skills. So it's too new to really know the quality of these professionals. I know a couple of people have been there. They're happy with the services they've got, but it's still in the beginning phases. A lot of it is, though, let's be honest, like when you're looking at a lot of assessments, neuro assessments, autism diagnoses, it is often a means to an end versus the treatment specifically. So I know you're talking about some of those other parts. Mine are more with the experiences I've heard about are from more the evaluation sides of it, which have been good. They've been resourceful. You'll see what it looks like in 5 years as everything kind of sifts out and balances. But I personally can't comment on like the rehab based treatment side of it, because I don't have any specific experience. But there is something to be said of you have to balance with, if you can get in there quicker, and then geographically it's closer, so you can do it more frequently or things like that. That can sometimes outweigh the benefit. My personal opinion would be like what I would do if it was my kid. I'd hold on to my professional in Ann Arbor and make them consult with my person in Saginaw till you built my trust. I have to trust you. It's not about skill, it's about relationship. Because the smartest therapist is not the best. Because if I can't build a relationship with you and we can't look at this and look at Nathan together and have similar goals, and I can build my clinical knowledge, but you can bring in your relationship knowledge, life knowledge. I love that better than my terms I've ever used. If we can work together, he'll soar higher. But if I just keep telling you what to do, there's not one answer. Every situation is different for every family. So you've got to be really present and in tune to the styles, working with a lot of people with autism. The number of dads who just don't understand how to get on the floor and play, it's gone down a lot. But it was really high when I started. So I would sit there and model, I would play and I would engage. And it was my favorite. One of my first kids who, like, little girl just finally came up to dad and gave him the biggest hug and the greatest eye contact. And he's like, we're doing this. Okay. How do I do this? How do we do this? How do I keep going? Because you could see it kind of bought in. But I think, so to your part though, I think it is going to be interesting. Can I flip it and learn from you though? What is your opinion or
I don't
you
do
so
it
far?
because we never received vet services there,
Yeah.
so I only.
Have
can
you heard
make up-
anything?
Well, I know my Michigan lost people to it. Cause we had a therapist leave. And I know. My initial comments were, give it 3 years before you would consider taking your child there. Cause they need to work out their kinks and your kid cannot be a casualty. My child was very medically complex.
That's very fair.
So for me personally, like if he had another brain hemorrhage today, I would still stay and go out in a heartbeat.
For
Because
sure.
the support services to me and my family.
They will never
like our
compete with that
inpatient-
support services for
Yeah,
sure.
like when we saw our bills from Covenant, because we are Saginaw County.
Yeah.
Versus our bills from U of M, Covenant, I was there 2 days, U of M, I was there 5, and it was the same dollar. So U of M is just so much cheaper than Covenant was to me.
And
They know what they're doing.
and
I have a friend who's an NP over at the children's wing of U of M, and they do great work, and she's very smart.
And,
I think-
and the time thing about how quick to get in, just a little caveat there is when we first were getting Nathan in somewhere and we got involved with U of M. At the time, he was just over a year old and Dr. Warbay here in town, we were referred to him because it's like, yeah, developmentally, there's things going on here. He saw him once. And then he made a referral to Detroit Children's Hospital and U of M. And he said, I'm gonna do both and whoever gets you in first go. Well, they were both over a year away to get in. But one key trick is to say, can you put me on the wait list?
For
And
Kansas.
what for cancellation, is once you're in the system, you're in the system. And then, you know, you do that, but that's exactly what we did. So the first, it was like, they first told me, they were like, I was calling in January and they were like, yeah, the next appointment is July 2000, whatever year it would have been 2005. They said, I said, you mean 2004? No, they said 2005. And this was in January 2004. And I was like, you mean 2004, right? And they said, no, 2005. I was like, holy cow. I was like, well, yes, I'll take the appointment. And then Detroit Children's had one about the same. U of M, I put them on the cancellation list. A week later, they called and said, yeah, we have a cancellation. Boom, we were in. So, you know, that's a big major thing to get in quicker.
I think those
And
are
just drop whatever
important.
you're doing.
And I'm gonna go back to, no matter where you go, and this again is my bias, but it's what we were built on. It was the foundation long before insurances or autism or anything else came in, was this need for was specialization for children, that were not everybody's therapy corner, it's children's therapy corner. And one of the things that I will say to any parent, and if you are in the schools or you know of people who are just beginning, what is your relationship with your therapist? We want you in the therapy room. We want to have a conversation. It's not just go home and do these 15 things. It's like, come in and sit down with us and see what we're doing. Does it make sense? What can you functionally do at home? What would match with your family? We're not to give you 15,000 handouts and say, okay, now go do more homework with your child after school, which is like parents go, what? And I remember having a consult with a family, and they were executives at Dow, and Laurel Bucci had said, you got to go talk to Janet. And this is when I was still working full time, and they come in and they're diligently writing. I mean, I think I could have said the sky is purple, and they're going to go, the sky is purple, because there was just so much anxiety of what are we doing and what's going on and what can we do and yet. And this was at a consult. And I finally realized that their anxiety was so high, and understood that. This was way back before it was that many more families. And I thought, okay. And I said, you guys are really good at writing down notes. Okay, so you ready? You got to write this down. You're going to write this down, right? And you're going to go home and do this, right? Yeah. I said, good. I want you to go home. I want you to open a bottle of wine. I want you to sit down. I want you to rediscover each other. We got you. Let's go. Don't keep worrying. You're in this together, and you are part of this collective, and we're going to work with you and talk with you and help you and everything else. And you could see them both just going. And the child did great. But it was the beginning of a relationship of, let's do this together. Let's not just send your child into another room and then bring them back out and you're sitting in the waiting room. Let's talk. Let's learn this together. I don't care where you go. You are professionals. We work for you, not the other way around. And when you find the people that you think do good service delivery, expect that they make certain you're part of that delivery system. And you had a question about 30 minutes ago. What was your
Well, I have two, actually. One is, this really does apply to like all kids, because, you know, for my son has a lot of friends at school and everything, and that are, you know, and not just at school, but whatever. So we get a lot of questions about this in the group too. I feel like there's a real serious lack in this area of social skills, opportunities and training, practicing social skills. And my son did attend like a couple sessions of a social skills, you know, group, that was great, and it really, but the one thing that was kind of lacking that, was bringing in, some peers. Because, while it still was great, and I think everyone learned a lot, it was, like, I'll just give one example of, we played that like headbands game, where is that what it's called? And then you
Headbands,
put the
okay.
card on and you have to, and like and in this case, well, it wasn't just autism, but any kid that said, had autism or whatever, the second you show them that visual, they're supposed to be asking questions, and instead they're like, car, like, or whatever. It's like, no, you're not supposed to say like what it is. But so I did have a question about, because I had called Children's Therapy Corner when my son was young, asking about social skills groups, because you just don't have a lot of time in school, like in a school setting in particular for that. The social worker does work with the speech therapist, for my son at lunchtime. They do a social skills group twice a month, I think, or whatever. And so that's something, but again, they can't bring any peers into that because it's like confidentiality, and we're working on IEP goals and la la la. So I didn't know in a private therapy setting whether, and the answer at the time when I asked Children's Therapy Corner, whoever I had talked with said, we have a social skills group, but you can't bring your son to join just the social skills group. It's for kids that are doing speech and like other therapies also here. You can't just, come and join the social skills group. But
I
in
might
any
have a
case,
solution for you.
yeah, I mean,
Yeah, 'cause we were talking about
but-
it with,
yeah, I guess my question though
Not
is like,
therapy-based.
if they still do, or if you still do social skills group. And also in a private therapy session, if there is any way to bring peers in that can model, or if there are confidentiality issues or whatever. And of course, the peers would have to be, volunteer based or whatever, but usually it's kids practicing social skills with adults.
And that's not
boy, it would be
perfect.
so great if we could have some kids
our
work with
robotics
kids.
team's literally just talking about that.
Yeah.
That's what part we were talking about on Fridays. They want to provide a STEM social group
Okay.
for this.
So we will talk later.
That's what I'm
because
saying.
my-
But
yeah,
I think that, and that's great. It is hard. It is very hard to do, and you can feel like it's kind of almost like within a private practice. How many opportunities do we get with peers? One of the things, and I'm gonna wait till she's done, because you gotta hear this.
No, okay, I'm good. Thank you.
No, the reason is because I think it's great what you're talking about, but you have got to train the adults how not to do the talking. That's one of the bigger problems too, is that, well, as you can see the adults saying, well, just tell her that you want that. Okay, now who's doing the social?
Right.
You got to train the adults who are
So
gonna
you
be in
gotta-
that environment.
I want to clarify that. So what I would expect from this type of thing is I have 25 of the robotics team. Their adults aren't showing up. Trust me that one.
I know that my son finished with all this.
I was gonna say, their adults aren't, their kids show up, drop them off, their parents do, because those are all typical children, let's call it. Okay, so the adults I'm really needing to train, I just wanna make sure this is us, the parents of the special needs kids, who are more likely to hover, because our children haven't had the same upbringing. That's what you're telling me, correct?
That's it's not upbringing, it's a different methodology.
Okay,
So
It
as
just
it,
doesn't come as quickly, yeah.
Right.
Upbringing, it's,
right,
it's when we're all used to having to be.
You're having to do it.
Yeah.
you're the advocate at all times.
you're exactly right. And in fact, Kathy and I've had some conversations about this, is that you're both speech and language pathologists. We happen to start, run, own a company. We're not some big I mean, we're it. This is, you wanna know who owns it?
Hello.
They're right here. But we're speech and language pathologists very strongly. And all I meant is that especially something very small like, if you got a child who's looking at another child, don't let them see your face. Get behind your child so that their faces are together. It's little things like that. Or how do you, even turn taking? Are there some ways to help in that, in engagement? I'm saying is that socialization is vital, but you have to be also cognizant. And it's not that parents are doing anything bad. But you have to be kind of cognizant also of, how am I making certain my child is doing this and not me telling my child what to say? That is, you see what I'm saying? It's just those little nuances, but it's hard to do and get good social groups. And sometimes you got kids that if it's 20 other kids, they're not going to say a word. That's too much. It's too much. I can't deal with it. But if I got one or I got two, then it's easier for me.
So
But
is
it's a
it
hard one.
possible to have to bring, is it possible in that setting, or has it ever been considered to bring, like my son's best friend, you know, at school? Would it be possible to practice social skill, you know what I mean? Like to bring a non-patient in with a patient, I guess.
Let's walk through, because like it's a dichotomy of options of answers. And all the answers I could say yes, and we could just be done. But let's walk through a little bit more of that could look like. So when you're talking about, say, individual services, which for me, who works on social skills, it is to build the baseline knowledge. I have to teach you how to use the hammer to then send you to the construction site to practice using the hammer. So it is from an individual service. You could definitely, if there's only one child in there who you're billing, if you have a goal that works on social or peer interaction, we can pull in. What we typically do for kids is pull in other kids receiving similar services who have similar needs that either are similar or actually what we like is the complement. So they fill each other's holes. So that's the nice part about like having, in Midland, we have 9-12 therapists plus all the ABA people. So you have, 30 to 50 kids in the building at those prime hours that you're picking from, being able to try to have some interaction. You can also look at it for sure. You can bring in a peer or other pieces like that. This is a 2026. My most recent was last week. We were working on the pairings of how to do that via voice chat for Discord to play Roblox or Xbox, because that's most typical interactions these days. My son has a dozen friends, and the 90% of the time he sees them is, well, he doesn't see them. Sometimes they turn on the FaceTime, but they're doing video games together. So we're trying to teach the skills that are most relevant to their utilization of them. So it's like, how are you playing with your friends? How are you doing those? Now you have the others, like you can definitely bring in peers. We've done that. We've also done siblings. Like if you have a similar age sibling, because sometimes they don't have to be the same age, but that's where you learn social skills if you have siblings around your same age, because that's where you play the most with. You definitely bring in friends, extended family, neighbors, the people who are in that circle. You get to have some of that, because if it's just you and we're just building like a one-on-one session, you can bring anyone in. And as long as it's applicable still to my goals and objectives, it's still billable by insurance, because that's a generalization of the skill. I can teach for days how to engage, how to have a reciprocal conversation, but it's so much cooler to give feedback on actually doing that with peers and walking through it and continuing to develop. You can sometimes cross over into like a social work, which we do not do those from social work or psychological services setting. So I'm going to skip over that, but I also want to give that recognition, because those are other opportunities and methodologies that even I'm looking into, because we did some of that. My problem with psychological services right now is I had a psychologist, and then COVID hit, and then like my therapist, they all wanted to go Zoom. And it's just, that's not the model we're looking for. We want face to face, we want engagement. And that's not like anyone here who has their own therapist. It's hard to find that. You have to like ask for it and be a little pushy on finding the one who has, if that's the model that you want. So, but then, yes, there have been, and I'll be very honest, for us, we're trying to build it back in because COVID derailed it. And then it was for like, it was almost till 2023 where people didn't want to be around other people. I mean, I had people wearing masks through 2022, which respect that great, but it's just a different viewpoint on how people want to interact. So
The other thing that I appreciate what Matt is saying is when you think about social skills, I use a lot of silly things, but I'm always talking about things are not like you can't cross the Grand Canyon in one step. So there are specific things that he said, okay, well, let's do some one-on-one. Okay, then let's do it with this other child. Okay, then let's do this. It's a systematic up. You will, I don't know the kids. I don't know what we're referring to, but if we don't have some of those basic foundations,
Yeah.
you can put them into an environment
Yeah.
and will they succeed? What is the foundation to build it up? And that's really all you have to be aware and cognizant of.
I guess what I'm kind of asking is with my one son in mind, because through, he's had speech, through school, and he's always done quite well in the one-on-one sessions, and wow, he's a rock star, he's meeting all his goals, and then we'll do new goals or whatever. But pulling out and working on things, he knows the answers. It might take him, a little bit longer to get the answer out, but he knows them. But then take that same kid and put him in with his same age, typically developing peers, and it's like he has no skills. But it's like he gets an A for his speech from his speech therapist, and then you throw him in with a,
and that's what I'm talking about.
And
you can't cross the Grand Canyon. That's exactly it. That I gave you some foundations. But you get foundations, and like you said, and you can kind of go from this to this to this to this, and you want to make certain that it's like if I were going to say, well, let's do a marathon. Well, I'm not, but maybe you would. What do we have to do to get prepared for the marathon? You don't just say, oh, well, I'm going to run tomorrow. You have to make certain that you have gotten the foundation in place. And it sounds like that's probably what your son has been able to receive. But the next step is a next step. It's not all the way.
Yeah, I feel like how not really practice with the
Correct.
typical peer if he never gets a chance to really practice with the typical peer, I guess is what.
But that's right, but it's like one peer versus 4, and that's all I was saying.
Is he in services now?
Yeah, speech. I mean, not in school though, so
He's
it's
only receiving, and let me tell you, there is a huge difference, this. Huge difference between school services and outpatient services.
Yeah, I mean, they get like 15 minutes, it's like,
right.
Well, and no, like it is literally, like speech, it's like, I don't even know how to explain it, they are totally different, 100% different.
Yeah.
Because the only goal of speech in a school is to get them to function in a school environment.
And to go to the next grade, yeah.
I don't know if I agree with that.
No, that is literally what
I mean,
you're told by the
state.
It is our profession. We are only allowed to work on things that are impacting directly to my school.
Academic
and I can only
success.
hit
You want
things academically at the grade level the child is at. So if you have a splinter skill down here that is not filled in, I can't directly write goals to it. I do have to keep it paired to the curriculum the child is in that is directly impacting their function in the school system. So it's compartmentalized. A lot of good therapists will massage around the rules. So that could be a lot of different experiences.
More PT can't be massaged.
Miss PT is very, very good.
So we haven't answered your question yet. So I think he's gonna deep dive for you.
So yeah, let's walk through you because we've talked so general. I think as you look at like in the schools, each school is very different. But if there's, like you're saying, if we want to start with what you're doing, if there's ways to incorporate peers into services, or because there's not a whole ton of peer-based programs to bring in supports for kids who are needing help. I know it depends on the school, but I know lots of schools that will take a child and they'll pair them up with someone either same grade, or sometimes they like to take the one who's a little older and pair them with someone a couple years younger and kind of be like the big buddy support.
Yeah.
So I can't speak specifically to your school, but I think you can start asking and learning a little bit more of what the school offers and provides and is able to incorporate, that then could be included, say, into like IEP seasons right now. So I'm trying to get some pieces going to keep supporting that, because we're talking high school typically.
Yeah.
There is a program in the high school. It's almost sometimes even
Well, you have one, what's the program where they go to at the lunch?
Yeah,
without
my son, that it's not, it's called lunch ones, it's offered, but not none of the gen ed peers come, just the, just the kids with IEPs go, so it's not, here really, it's, they invite them, but they don't come, so, yeah.
But that's like
Only the siblings of the
Yeah.
special needs kids go.
it's at least a
Sometimes.
good start. She likes the example Grand Canyon. So if you're here and here, that's maybe getting a little bit closer, because it's getting the interaction like we started with. You're removing the adult and putting another peer into it. It's at least
They're attempting the best of their abilities, because they can't force the
yeah. Now I know
non-IEP kid to show up.
Yeah.
they tried, there's so many requirements now to get like observation or whatever they want to call those hours for the gen ed, that those things starting more and more to qualify. Once again, we're in big picture. Back to you though, it is building up those opportunities with, if we want to talk from like a gen ed peer, of how to build those in. So if it's with the school, whatever services they'll provide, or if it's like with an outside service.
Yes,
Like-
children's therapy corner, like.
Perfect. So like we take, I was just giving the example of the kid who he's working on 1 phone calls, 2 I think it's the same boy working on Xbox, and like I want to say appropriate social interactions with peers, but I also want to acknowledge that they're like young teenage peers, so they're never appropriate, but within reason to appropriateness.
Right.
So you can do some of that practice. So it's like you practice the skill set with the trained professional. Now I'm very biased because I can pretend to be a 12-year-old boy very well compared to your average therapist. It's a skill I have. It's why my son loves me. It's why I'm good at what I do. But that is what you want to build up the knowledge, because what happens is no matter what you do, and you take like a child like yours, they drop developmentally a little bit into that social situation. Everybody does. That's why, especially when your brain's developing, that's why kids in groups are dumb. We all know that for ourselves and for the people we know. So building that skill set, so we have the tools. It's like you said, I know the answer, I just can't get it out as quickly. How we can build up the speed and the response, and then incorporate and understand how to use it, or even come back like, hey, this is a goal we're working on. You're going to go play with your friends tonight, or you're going to go Xbox online or whatever. And then we come back and it's almost like a debrief of that session. But you, as the parent, are our spy. And you get more information, you can give some of that feedback. Sometimes the kids are okay with that. Sometimes it has to be a separate conversation, because I don't want mom listening to me playing with my buddies. But you can then sometimes, what even works, now this is just individual, you can always bring a peer into a service. Now, like you're saying in schools, it can't be required. I can't require a peer.
Right.
I can use other kids who are IEP based.
I was more curious about like an outside of like what your, practice would do or whatever, not your opinion of like in the schools.
Yeah.
Because, and in fact, my son his speech just moved to consult, so it's a non-issue now anyways for him.
Okay.
But yeah.
Pick up friends to therapy all the time.
Yeah.
It's like
Take a
the
minute.
speech or.
Yeah.
You guys are good.
But you guys don't do that age of a kid though, it sounds like a 16-year-old.
Sure we could.
Yeah, if it's because what you're describing is appropriate developmental of social skills, which I'm guessing we're looking at more like the 10
It's
to
like
30.
thematic speech, because it's not, it's more like, teaching him things like, because he doesn't have, it's not like I don't know how to put it, whatever, I'm not a speech therapist, but
That's
he
okay.
doesn't have challenges with his speech, he
Oh.
has more challenges with understanding how to socialize.
The language.
So, yeah, so he'll, like, for example, I didn't realize for the longest time that he didn't realize when someone asks, you know, how, like, hey, how was your summer? You don't have to sit there for 5 minutes and analyze your entire summer to find the most correct answer before you replied. And by that time the kid ran away already, you know, like, you just have to say good. Like, cause the kid thinks you're ignoring them, you know, if you're not answering for 10 minutes. And then they gave up on you and ran away. And I'm like, just say good. They don't really care how your summer was.
Yeah,
Just say good, you know. so that
And when you
it's
talk
fine.
about speech, you're talking about the wed rabbit or one and
I'm
the
talking more about like speech in a social
That's,
setting.
well, but speech can also for us is it's the wed rabbit one and the woad, it's articulation. We're not worried about the S's and the
Right.
R's and the TH's.
Yeah.
What he said is, it's language, it's processing, it's pragmatic.
Well,
it's
she just went
how-
the theory
right.
of mind and putting yourself in
Right.
your listener's viewpoint. All of them great skills to address and work on.
Yeah.
To your answer your question, that's very appropriate because we're not talking like vocational, we're not talking transitions. Those are something we would come in. Typically we'll see that like that 12 to 16, 17. We'll have that smaller group that kind of come through it. You know, we get a bunch of them younger, we get them at that age too, like robotics. There's other community supports as well that we can do great. We're knowledgeable on it, but what we want to do is, like your example, work with the parents who are going into robotics to then continue to provide you the support. Bring in a peer, do
But you
those
can do it.
things. Lots of things. And yeah, we work at Children's Therapy. Speech therapists can do that. Now the question is, are they being trained by their company and their mentors how to do it and how to do it well? Ask the question and learn about what their experience has been or what they would be able to do there.
I
But
think you had
we do
two
a lot.
questions, but I know she's
Yeah,
gonna say,
let's
we've been here
let's-
2 hours. You guys are
You know what
good.
time it is.
Yes, exactly what I wanted to say, but specifically for the recording, I just wanted to